Hi, I'm Dr. Dave Janda. Welcome back to the Operation Freedom YouTube channel and our special segments that focus on your nutritional wellness and health. Today's topic is going to be opioids, big pharma, and your nutritional health. I can't think of a better person to have with me than, I believe, the top naturopathic physician in the world, Peter Glidden. Little background on Peter for those of you not familiar. We have an entire series of these presentations, actually. This is the fourth in the series. You can find all these presentations either on this YouTube channel or at operationfreedomhealth.com, or actually even my website. We have a special section for Dr. Glidden at davejanda.com. Back to Dr. Glidden. Background. He attended Williams College, received his Bachelor of Science degree in pre-medical studies at the University of Massachusetts, then obtained his doctoral degree in naturopathic medicine from the great Bastyr University in Seattle, Washington. He is currently a member of the American Association of Naturopathic Physicians. He presently is in private practice of naturopathic medicine, has been licensed to practice naturopathic medicine since 1992. Now, in addition to his clinical practices, Peter is an outstanding author. I know a number of you have bought his books. I've had incredible feedback from you, our viewers and listeners, how much you enjoy those books. For those of you that haven't, you can get the books. They're fantastic and a great foundational basis to your, if you will, nutritional well-being. Everybody is sick, and I know why, and attempt a cure with holistic medicine. Both are available on Amazon. It's my honor to welcome back Dr. Peter Glidden. Peter, welcome back to the Operation Freedom platform.
Thanks for having me, Dave. It's always a pleasure to spend time with you.
Peter, I want to confine our conversation today to the opioid issue. It's starting to get a fair amount of press. Unfortunately, I do believe there has been, if you will, an avoidance of speaking about opioids in the way we're going to today. In particular, I want to break this down into, it's been said that nutrition has nothing to do with pain or pain management. I want to touch on that, obviously. I also want to talk about your opinion on big pharmaceutical companies' role in this opioid crisis. And the third is really a call to action of every one of our viewers of what they can do if pain situations raise their ugly heads in their lives or their families' lives or friends' lives, what they can do, not from throwing pills at the issue, which seems to be the allopathic response, medical doctor, MD approach that I learned as a physician going through the training process, but more from a nutritional standpoint of what can be done. So first, the first issue, nutrition has nothing to do with pain or pain management. Peter, set us straight.
Yeah, it's a cultural myth, like, women aren't smart enough to vote, right? It's reality by consensus brought to the table by people, health professionals, medical professionals who have no training, no experience, no respect, quite frankly, no appreciation for science-based, clinically verified medical nutrition, right? And so it's a big deal, but it also speaks to kind of a bigger issue, right? Conventional medical doctors who are in the majority here in the United States and most industrialized nations in the 21st century are trained in a type of medicine called allopathic reductionism. And allopathic reductionism rarely attempts to get to the root cause of what the pain in this case is, right? Yes. Conventional medicine has no idea what causes arthritis, no idea how to cure it, no idea what causes fibromyalgia, no idea how to cure it, no idea what causes reflex sympathetic dystrophy, no idea how to cure it. And so inside of that paradigm, when a patient presents legitimately in pain, conventionally trained medical doctors, I mean, bless their hearts, they only have so many tools at their disposal. You know this better than anyone. And the tools that medical doctors have at their disposal for pain are, well, pain medications and anti-inflammatories. And those medications are effective temporarily. They suppress the symptomology while doing nothing whatsoever to get to the root cause of why the pain was there in the first place. So guess what happens? As time goes by, the patient needs more pain meds, and then they need more pain meds, and then they need more pain meds, because the body gets used to, habituates to the pain meds. And so you need more to produce the same effect. Just like when you start drinking alcohol, you You need more and more and more to feel the same effect. Well, it's the same with pain meds. So the opioid crisis, which is a big Megillah, it is a big, bad voodoo daddy here. Let me give you some of the numbers. According to the Centers for Disease Control, 2017, about 50,000 people in the United States died from opioid overdose. 17,000 of those were from prescriptions, right? They go to their doctor, they get an opioid, they die from it. When you compare that to 15,500 who died from heroin, right? So more people substantially are dying from opioid abuse. And why are people abusing opioids? Well, it's not because they're drug addicts. It's because they're in pain.
Right.
And conventional medicine has little to offer them by way of any effective long-term treatment. So what happens? Well, we go round and around the rabbit hole until everybody goes down the rabbit hole, because conventional medicine, which is fantastic for trauma care, surgery when it's necessary, and a handful of infectious diseases, is absolutely, positively, 100% incapable of addressing the root cause of pain. And this is a problem, right? Because it's a monopoly and it's the only medicine people have any access to. It's the wrong dog for the pain hunt, but it's the only thing that people have access to, so they're going to do whatever they can. And once they start going down the opioid train track, it's not good.
So what would you suggest for those folks that have, let's do acute and chronic, okay? An acute event, they're having pain, as opposed to going to the pills, what would you suggest from a nutritional standpoint?
Well, okay, so we need to, the first question to ask is, what's causing the pain?
Mm-hmm.
Is it from a bone and a joint issue? Is it from a muscular issue? Is it from a neurological issue? Has there been trauma? Has it just been like a slow increase over time? It's not that there's one umbrella treatment for all pain, right? There's a lot of different operative causes of the pain syndrome, and we need to have a fundamental understanding of which one it is. However, from the medical nutrition perspective, right, there is a foundation where we start with everybody, regardless of what category of pain they're experiencing, because the fundamental naturopathic, holistic medical philosophy believes that the human body knows how to fix itself, the human body wants to fix itself, the human body's trying to fix itself all of the time. So it's the holistic physician's sacred obligation to generate therapeutics which support the body's ability to be healthy and strong, and in this case, pain-free. So what do we do with everybody who's, in this case, experiencing pain? Everybody, without question, gets the 90 essential nutrients, the 90 essential raw materials that the body needs to support and promote its healthy structure and function. And we counsel people to, hey, you know what? Maybe it's a good idea for you to stop eating food that's gumming up the works. Maybe it's a good idea for you to stop putting diesel fuel in an unleaded engine, right?
Right.
Just makes sense. So we take care of these two fundamental things first. We give the body the raw materials that the body needs to fix itself, and we counsel people to stop eating food that's gumming up the works. Those are the first two steps, and we see how far that takes us. And then if it's a bone and a joint issue, we do extra bone and joint support. If it's a neurological issue, we do extra central nervous system support. And when we move down the road like this, we get much better results.
And for those, and I can speak to that, Peter, because last year I had a traumatic event, needed to have surgery, and I was already on the 90 essential nutrients, had been for a couple years. And after the surgery, the doc said to me, well, this can be pretty painful afterwards, Dave. I'll give you a prescription for some pain medication, and you get this filled on your way home, and because you're going to need to take this. Well, I didn't fill it, and all I did actually, Peter, is I doubled up on my 90 essential nutrients that I was taking. Rather than taking 2 scoops of the Total Body Start Pack, I was doing 4. And I go for my return appointment, and the doc looks at me and said, "Well, how much pain medication do you take?" I go, "I didn't fill it." He goes, "What?" He goes, "Well, you had some at home or something?" I go, No, I didn't need it." And he said, "Well, what do you attribute that to?" And I said, "Well, I think it's because nutritionally I was on a really great foundation because I had been taking this Healthy Body Start Pack for an extended period of time beforehand, and I just doubled up on it afterwards." And Peter, I've known, and this person looked at me and said, "You really believe that that this nutritional support prevented you from having to take pain medication?" I go, "I didn't do anything else." And I go, "I don't think I'm particularly a stoic person when it comes to pain," right? Right? So to those people, Peter, and as a physician that took care of people, as an orthopedic surgeon, seeing folks from traumatic, Peter, I don't ever remember a patient who wanted to keep taking pain medication.
Exactly.
Okay? All they want to do is be out of pain.
That's right.
Okay. They want to be out of pain. That's good. So to those people that are currently taking opioids, that don't want to be taking opioids, they just want to be out of pain, what would you suggest to them? What is their action plan?
Well, so it's real straightforward, right? So we give the body the raw materials it needs to fix itself because the body wants to fix itself. I mean, you cut your finger, but you don't have to tell your body to secrete fibrinogen and upregulate macrophage response time. Nobody even knows what the heck that is except you and me, right? But it happens all by itself. So your body is trying to fix things all the time, but it needs raw materials to do that. And most of the raw materials that it needs to get that job done, they're not present in the food. Some of them are, but not all of them are. So it's not rocket science. We nutrify, and we get the heck out of the way with the dietary discipline. So, the recommendation here is really pretty straightforward. 1 Healthy Body Start Pack, 1 bottle of plant-derived minerals per 100 pounds of body weight per month, more or less, is a really, really good way to support and promote your body's built-in God-given ability to fix itself. And there's another thing that the pharmaceutical industry knows, that every pharmacist in the world knows, but nobody talks about it. It's the simple fact that when you take a prescription medication, and by the way, a lot of people don't understand, and perhaps should understand, that naturopathic doctors like myself, licensed and regulated naturopathic doctors, have the ability to prescribe drugs. People think, oh, those naturopaths, they're against medications, they're against prescription medications. No, we're not. Thank God for Novocaine. Mm-hmm. Thank God for lidocaine. Thank God for insulin, right? Thank God for a handful of antibiotics. It's not the drug, it's how it's used. It's not the gun, it's how it's used, for goodness sakes. But when you take a drug into your system, a pharmaceutical medicine, that pharmaceutical medicine does work in the body. It upregulates biochemical process here. It downregulates the biochemical process here. It does work. It engenders work. And the work that it engenders is all done by the raw materials in the human body. It's not pixie dust and sunlight. It's vitamins and minerals and amino acids. So the longer that people take prescription medications, the more those prescription medications, by virtue of their action, burn through those people's nutrient reserves. And this is one of the reasons why over time the drugs stop working. And then the dose needs to be increased, or you need to add a second drug or a third drug and then a fourth drug to counter-effect the side effects of all those drugs. It's because the drug itself, in its action on the body, has burned through your nutrient reserves, because that's what it does. Mm-hmm. So when we give to people who are taking, in this case, pain medication, fundamental medical nutrition in therapeutic doses that you can actually absorb, the medications work better. Mm-hmm. So people don't need to take as many of the opioids. They can reduce the dose. They don't need as much, because you're absolutely right. People aren't inherently drug addicts, and they're looking to be addicted for the rest of their life. They're looking to get out of pain, for goodness sake. So when we nutrify, we accomplish two things. Number one, we provide the body with the stuff it needs to fix itself, and when it fixes itself, you're going to be out of pain. And number two, we give, interestingly, ironically, we give the drugs the raw materials that they need to work better. And so it's like never fail fudge. It works every time.
Well, and this also works on a chronic standpoint, and I can speak to that when you talk about arthritis. I was diagnosed with arthritis in my neck and spine for years, and ever increasing amounts of anti-inflammatories, not narcotics, but anti-inflammatories. And when one wasn't cutting it, they were adding a second. And it got to a point where they said, Dave, you're probably going to need some type of surgical procedure, fusion procedure on your neck and on your lower back. And at that point, that's when, frankly, Peter, I ran into you several years ago and said, well, that's all great, but the surgery thing, but and I went on the Healthy Body Start Pack, and Peter, within a month, I was off of the anti-inflammatories.
Yeah,
the pharmaceutical grade anti-inflammatories, Peter, and I wasn't having pain. I went to see, again, a different doc, my arthritis doc, about it, and he looked at me and go, well, you're really doing good. What'd you do? And it's right. It's the nutritional foundation, and I attest to it from a chronic standpoint, pain standpoint, and also from an acute standpoint when I had this event last year.
Right. It's an interesting thing to think about when it comes to the arthritic condition. As an orthopedic surgeon, you're going to get this faster than anybody. So let's say somebody needs a knee replacement operation, right? Why do they need a knee replacement operation? Because the knee joint has gone south, right? The knee joint has become diseased. The knee joint isn't working the way that nature and God intended it to. So what do? Well, you open the leg up, you remove the knee joint, you drill a hole in the big bone in the leg, and you stick the fake knee, the titanium knee, the metal knee in there, and you secure it. There's a little rod on the end of the prosthetic knee that goes right into the hole that you drilled in the bone. All right? And then you sew everything up, keep your fingers crossed. Bada bing, bada boom, Bob's your uncle. All of a sudden, life is good. Except 5 or 6 years later, maybe not even, maybe 2 or 3 years later, that metal post that's in the leg bone starts to wiggle. And then there's more pain. And so the person needs another surgery to the same knee, and then another surgery to the same knee. Why is this happening? Because in the first place, the knee joint went south, not because you had a bad gene, not because you were getting older, not because you had a voodoo curse, but because your body ran out of knee joint nutrients. And did the surgical procedure put knee joint nutrients back in the body? No. All it did was put a fake knee in the body, and now the fake knee is resting in a bone now that still doesn't have bone nutrients. So over time, it's going to start to fail. And so what our experience is with people who are in this particular situation, which, by the way, is very, very, very painful, when we give people who have had knee replacement surgery or hip replacement surgery or shoulder replacement surgery, and it's starting to fail, when we give those people medical nutrition in therapeutic doses, the bone sucks right around the prosthetic piece of metal, and it hardens right up to it. It's like digging a fence pole, a fence post hole, and putting concrete in it.
Correct.
Right? It's going to stabilize it. So what happens? Well, the joint stabilizes, no more pain. The patient doesn't need another surgery. They don't need any more pain meds. Why? Because the body has fixed it. And, this isn't 100% guaranteed panacea cure-all.
Right.
But it's extremely effective, and it should not be overlooked.
Peter, I now want to turn to Big Pharma, and,
Sure.
and the role in the opioid crisis. Many of them take their hands away and go, well, we didn't have anything to do with it. And might I say, the government has taken their hands away and said, oh, we didn't have anything to do with it. I can tell you that about 5-6 years ago, as a treating physician, we were told by the government that if our patients were in pain and we weren't prescribing enough pain medication, we could be held criminally liable for the pain that they were in, and that the government would serve as witnesses against those physicians that weren't prescribing enough pain medication. Now they've done a complete 180 on it.
Well, I mean, it's good to be the king.
Yeah, right.
Absolute power corrupts absolutely. And, you know, I go both ways on this issue because I honestly don't think, or at least I don't want to think, that there are organizations of people in the world who are inherently sadistic and who are inherently all about making more money and damn the torpedoes, and it doesn't matter what the collateral damage is, it's all about the Benjamins, right? I don't think that's the case. At least there might be one or two people that, you know, are in positions of leadership where they feel like that, but I don't think that's the case. Most medical doctors that I know are decent, honest, caring human beings. That's why they became physicians in the first place, for goodness sakes. But when all you have is a hammer, everything looks like a nail.
Right.
So you got somebody in pain, you got to handle it. What are you going to do? Well, you're going to do the only thing that you have been taught to do: pain medication, anti-inflammatories, pain medication, anti-inflammatories, surgery, pain medication, anti-inflammatories, until, well, sorry, it's not working anymore. We don't know what to do. Going to kick you out of the office because we've expended all of our resources. You really must have the bad gene. And then the patient's left on their own. Now they're addicted to the opioids, not because they were drug addicts, but that's a side effect of the medication. Their prescription is no longer good. They got to feed the needs, so they start using heroin. Mm-hmm. Not because they're bad people, but because they have a chemical addiction. Right. The chemical addiction was engendered by the medical treatment, which was insufficient to the cause, and was insufficient to the cause not because medical doctors are uncaring, sadistic, money-grubbing fiends. It's because that's all they knew. And that's all the government knows.
Right.
And it's like that. It's just like, you know, a whole culture of colorblind artists who don't know that they're colorblind.
Well, and now we have the government saying, okay, we have this opioid crisis. It's a huge problem. We have to do something about it. Good. Okay, I'm glad that has been recognized. But the problem, Peter, is they haven't gone to the next step. Because now you have all these people who are on opioids who are saying, well, okay, I don't really want to be on I don't want to be on these things. I just don't want to be in pain. What do I do? And the government right now is lacking, if you will, the information that you provided earlier in this segment. That we need to bring that.
And that's because of the medical monopoly that's existed for 107 years.
There aren't any lobbyists from the nutritional side that are going to these Congress critters and saying, hey, bring up the nutritional foundation of folks. They'll use less opioids. They'll be able to get off of them much easier. There's no lobby doing that.
There's so much cognitive dissonance around this issue. Because of the monopoly for 100 years, that most medical doctors, most politicians actually still believe, right? Yes. Not that the earth is flat, but something equally as ridiculous. Oh, you're going to take vitamins? They'll just give you expensive urine. It's a waste of time. It's a waste of money. It's absolutely nonsense. What are you talking about, vitamins? That's actually what they think. And, you know, I could lay out reasons why they think like that. But this is a function 100% of people not knowing any better, and gigantic lobbies with lots of money forwarding their own agenda, which is the wrong agenda, but it's the only agenda because they won't let anybody else into the game. For example, most people in your listening audience might be surprised to understand that in the United States of America, the only thing that can legally treat a disease is a drug. The only thing that can legally treat a disease is a drug. Now, who made that law? the pharmaceutical industry
That's
made
right.
that law.
Right.
If I discovered, that earthworms cured cancer,
Right.
and I proved it, double-blinded, placebo-controlled trials which were reproduced and published in peer-reviewed journals, I proved it unequivocally, beyond a shadow of a doubt. The pharmaceutical industry would make the earthworm medicine a drug. You could only get it by prescription, and they'd charge an arm and a leg for it. So all of the vast promise that vitamins and minerals and amino acids, essential fatty acids, botanical medicines, and even food brings to the table are marginalized because of the medical industry and because, my people are destroyed by lack of knowledge. It's a tragedy of biblical proportions here. People are suffering needlessly. And, I think like you, I have a healthy respect for government and for the whole Constitution thing. And I'm not an anarchist at all. And knowing what I know about the relationship between the hospital industry, the insurance industry, and the drug industry, and Congress, and the Senate and the government, the immense power that those people have, I don't think it's possible in our lifetimes to see any substantial breakthrough here in this area. Where like all of a sudden it's legislated that you can use your medical insurance money to buy vitamins. All of a sudden, there's a lot of restrictions that are removed from the vitamin industry. I don't think that's going to happen in our lifetime.
And that's why it's up to the individual.
And that's why what you do is so unbelievably important, because we can't wait for the government to take this ball and run with it. We have to take that responsibility on ourselves, and that's why that's why I'm so happy to come on this platform, because we can make a positive impact in thousands of people in 20 minutes. Right. You got to love the internet for that, right? And this is very much the situation that we're up to. Like the fella said, history doesn't repeat itself, it rhymes. If the story's true, not everybody got on Noah's Ark, even though everybody should have. Right? So this is the situation that we're in. Not everybody is going to get involved with medical nutrition, even though everybody should.
Right.
And so all we can do is, stand on the highest mountain that we can and wave the flag as much as we can, and hope that we bring as many people as we can into the light here, because again, people are suffering needlessly.
Peter, is to close our interview here in our segment about a call to action. One of the things we've done is we have a website, operationfreedomhealth.com, where we have our initial video and the other videos that we have done on various issues. We also have the products available. Now, full disclosure, purchase of the products does help our platform, Operation Freedom, so we can continue to do these segments. We can continue to do the work that we do on the platform. So my question to you, Peter, is a call to action from a pain standpoint. What should folks do as their takeaway? What should they recommend? What should they talk about with their families?
Well, if you had a little struggling tomato plant, you're a gardener and you've got 100 tomato plants in your greenhouse, and there's one of them that was in the corner and it hadn't gotten any sunlight. You only got sporadic water and there was no fertilizer, and the poor little thing was dying. What would you do? You'd bring it into the light. Right. You'd give it water and you'd give it fertilizer. Right. And if you did that soon enough, before it passed the point of no return, well, guess what? The little plant's going to grow healthy and strong. It's the same with the human body. So if you are struggling with pain, you need to give your body the raw materials that it needs to optimize its structure and function and to attempt to fix the problem. The best way to start on that journey, the fundamental first step, one Healthy Body Start Pack, 1 bottle of plant-derived minerals per 100 pounds of body weight per month. And if you can't afford that, just do one of each. If you can't afford that, just do the plant-derived minerals. It's like $23 or $24 a bottle a month. This is the fundamental foundation, first step that you need to take. You do that for 90 days, see what happens to your body, see what happens to your pain, see what happens to your sleep, see what happens to your mood, to your energy, to everything, because it's a package deal here in the wonderful world of holistic medicine. That's number one. Number two, you must stop eating foods that cause inflammation in the body and that hurt the body. You got to stop doing that.
And we've talked about that in our previous segments.
3 times a day in the same spot. A couple weeks later, there's going to be trouble there. A couple months later, there's going to be big trouble there. You got to stop hurting yourself. And the 12 bad food list is on the website. A lot of information at Operation Freedom Health, by the way, that people can use to kind of get out of the medical mousetrap. And these are fundamentals, and we talk about fundamentals here because we're talking in a broad brush, right? And these broad brush strokes will help thousands of people really to optimize their body structure and function. It's a remarkable thing.
Peter, I'd like to thank you for everything you have done, are doing, and will do. You are an incredible resource for folks for their health freedom and in true empowerment. Again, all this information, folks, is available on OperationFreedomHealth.com. The products that Peter's spoken about are also available there, plus our videos, plus the 12 bad foods to avoid. That information is there, those videos. Again, Peter's books, Everybody is Sick and I Know Why, and Attempt to Cure with Holistic Medicine. I strongly encourage you that these books should be the foundation of your medical library. I know they are in our family. Peter, again, I'd like to thank you. I'd like to thank you folks for your time today. And as we always sign off, until next time, Dave Janda, thanks for joining us. Dream big and dare to fail. Thanks for your time.